This is Dr. John Wycoff, and today's episode we're going to talk a little bit about what I do and what functional medicine is. I'm going to try to help educate you a little bit about the different choices you have when you choose a doctor and maybe some of the frustrations and why you're getting those frustrations with the modern current medical system, because it really is a Pandora's box out there of issues and problems and the fragmentation that's occurring in conventional medicine today. So I am a board-certified family physician. Now, what does that mean? That means I went to a conventional medical school. I have a conventional medical degree. My degree is in osteopathic medicine, D.O. I'm a doctor of osteopathic medicine. I went on and completed my training with a 3-year post-graduation of medical school training in family medicine. So my board certification is as a family physician. I completed my board certification back in 1988 and then passed the certification examination. And since that time, I maintained my board certification by doing continuing medical education that's required to maintain my certification and doing testing that's required to maintain my certification. So all of that is part of what it requires to be board certified. Well, family medicine is a medical professional who specializes in providing comprehensive and ongoing health care to individuals and families throughout their lives. You can think of it as almost a cradle-to-grave type of approach. Different family physicians do different aspects. I did obstetrics back in my early career, and some doctors in family medicine do not do obstetrics, but most will do pediatrics through geriatrics. And they're kind of seen as your first stopping point with a medical problem. Maybe you have an acute medical problem, such as you have a cough or a fever, sore throat. Maybe you had an injury. You sprained an ankle or a wrist. Maybe you've had chronic problems with pain and in your low back or your shoulder. I've never really had that evaluated. Your primary care doctor or your family physician, sometimes called the PCP, primary care provider, may be your first stop. So that primary doctor provides that primary care for newborns to the elderly, focuses on preventative health care, screenings, immunizations, lifestyle counseling, diagnoses a variety of medical conditions. I used to say that I was an expert in coughs, colds, and sore holes, but infections, injuries, chronic disease, oftentimes serves to coordinate care to other specialties. Maybe you need to see a person for your back, an orthopedic surgeon, or you need to see a gynecologist for a gynecologic problem, and helps be an advocate for their patients' needs. There are great benefits to having a primary care physician, family physician, who can provide comprehensive and overall care, continuity of care, establishing that long-term relationship, access to preventative services and early intervention, expertise in managing complex medical issues, and focuses on the whole family and their unique needs. So that is my training. So I migrated a little bit from that world of primary care to functional medicine, and that may be a term that is new to you. So I consider myself now a board-certified family physician who practices functional medicine. Let's talk a little bit about the difference there between primary care or family medicine and a functional medicine doctor. So we've got a primary care doctor that could be a family medicine doctor or internal medicine doctor. That's really the board specialty that they identify with. In my case, is family medicine. But then I've taken that further and I've done additional training, probably as much or more training in my functional medicine work that I did in my initial medical degree. So a functional medical doctor is a professional who specializes in holistic and individualized approach to healthcare that focuses on identifying and addressing the root causes of chronic disease. And that's really important because traditionally trained doctors are not taught extensively about finding the root cause of chronic disease. And you probably have experienced this, and maybe it's frustrated you. If you have an acute problem, you have a cold, you have an injury, going to your primary care doctor most likely will help you get on that path to improved wellness and taking care of your health issue. They're very good at dealing with acute problems. But my frustration when I first got into practice really dealt with chronic problems. I didn't have the tools that I needed to help someone who had depression, anxiety, insomnia, hot flashes, night sweats, cancer, ADD, ADHD, and a myriad of other problems, hypertension, diabetes, fatigue. I just really struggled because my treatment for those, my diagnostic workup was minimal. I would do some basic blood tests, all of which you probably have had, a CBC, complete blood count, a chemistry panel to check for diabetes, kidney, liver function, maybe a TSH for your thyroid. And the doctor would say, well, your tests are fine. I don't know why you're tired. I don't know why you're anxious, but I have a medication for you. They have a pill for every ill. And a big part of medical school, traditional medical school, is to focus on a pharmacologic treatment and not really delving into the root cause of chronic disease. So I was frustrated with that conventional approach. I went into functional medicine, began to learn more about root causes. So I tell patients I have a bigger toolbox. My toolbox and options of diagnostic testing is much greater than your typical primary care doctor. I can look at things differently with a thorough history, an appropriate physical exam, oftentimes some in-office testings. We do a number of things in our office that can help us identify barriers. And then we have other tests that we might do. So I try to integrate the conventional medicine, conventional testing, which I do each and every day, CBC, chemistry profile, thyroid testing, PSA, etc., with maybe other testing to help us get to the root cause. And you might ask, well, what are those root causes that you look for, Dr. Wycoff? What things make you different? And it's a great question. A lot of it's based on your complaints, your symptoms, your history, your antecedents, your past history, what has led us to this point. But things we commonly look at, we may look at your diet and we may look at foods. We may try to determine if you have a food allergy. Oftentimes you have certain foods that you don't do well with, but you're frustrated because, one day you have a reaction, the next day you have the same food, or the next week, and you really don't react. And is that an allergy or not? Food allergy testing may help us with that type of symptoms. We can do that with a blood test. It's a little different than the typical skin testing you would get from your allergist, where you go in and have skin prick testing done. Maybe some of you have had that done. That tests for an antibody called IgE. IgE testing is great if you've got sensitivity to pollens, molds, because they'll be seen and identified by reaction to your skin. But they miss things like food allergies, which are governed by an antibody called IgG. IgG antibodies are measured in your blood and mean that your intestine is permeable or leaking, something called leaky gut syndrome. We'll get into that more in subsequent issues on the podcast, A Pathway to Wellness. But the correct testing can really help us identify problems with your gut, with your digestive system, or with foods that are contributing to those problems. So we can either eliminate those foods or we can treat those allergies. We have a different approach to treating allergies, and we'll talk about that more too. So that's just one test. Another test that we do often is hormone testing. Hormones are kind of the forgotten stepchild in modern medicine. We just don't always think about hormones or hormone imbalances causing chronic disease, but hormones are a big issue. So when I say hormones, what am I talking about? People think about the sex hormones, the hormones that are made by women like estrogen, progesterone, or men, testosterone, and clearly they are a big hormone. But the hormones that I look at are the thyroid hormones, T4, T3. We get a comprehensive thyroid panel on many of our patients who have fatigue or concerns about their thyroid. We also can do adrenal gland testing, adrenal hormone testing, cortisol, DHEA. And then we can do the sex hormones for men and women. And they're just as important for men as they are with women. We think a lot about sex hormones with women who have hot flashes and night sweats as they go into menopause around the age of 50, sometimes earlier, sometimes later. But men have hormones too. And the male decline of hormones is called andropause. And that can be identified and can be treated appropriately and improve symptoms that oftentimes have gone under the radar or are just not something that you've raised to a level of importance with your doctor. So in my world, we do a lot of hormone testing. We can test hormones a variety of ways. We can do blood testing. Oftentimes for men and even postmenopausal women, blood testing is adequate. And we would test the hormones that I'm interested in. Testosterone. There's a free and a total testosterone test that we like to get. Estradiol for men and women. Estrogen has 3 forms of estrogen. Estradiol being E2, diol meaning 2. It's the most predominant estrogen in both men and women. So we can check an estradiol level. We can also check the other 2 estrogens, estrone and estriol. In the blood. We also can check DHEA, which is an adrenal hormone, and cortisol. More often than not, especially in women, I prefer to get a saliva sample. This is not hard to obtain. You collect it at home first thing in the morning in a little tube. You submit it to a lab. We use a lab called ZRT Laboratories. You can Google them and find out more about ZRT. They are really a leader in this world of bioidentical hormone testing or hormone testing with saliva. And we can check all those hormones. We can check the 3 estrogens, progesterone, testosterone. We can check the adrenal hormone, DHEA, and cortisol. Usually we do cortisol throughout the day. We test the cortisol morning, noon, late afternoon, and just before bedtime. But we collect 4 samples if we're doing cortisol testing to look to see how well your body responds to the normal stresses during the day. And that can really help us open a door to find out what the root cause of your fatigue, your lack of ambition, your depression, your trouble sleeping is. So getting the right testing often will put us on the path to getting you better. One of the things I found out early in my practice is that making the diagnosis was always the most challenging part of being a doctor. The treatment's easy. You've got that magical thing called the internet and Dr. Google available. You can Google treatment for adrenal fatigue, treatment for female hormone deficiency, and you will find a myriad of solutions. So finding the treatment is not as hard as you might think, but knowing the right test to order maybe is what separates a functional medicine doctor from a conventionally trained primary care doctor, family medicine doctor, or internal medicine doctor. The other tools in my toolbox include something called a BIA. It's a very simple test we do in the office, bioimpedance analysis. Measures the resistance through your body, measures how healthy your cells are, how healthy the cell membrane is, how water distributes in your cells, what your body composition is. And we can use this as a tool to help us decide what other testing may be needed. The testing might include testing for heavy metals. We do heavy metal testing and then treat it with a process called chelation. If we are concerned about heavy metals, we can get you appropriately tested and can treat you appropriately and safely with forms of chelation. We have oral forms, IV forms, different ways to approach that. If we identify the problem, we have to identify the problem. So heavy metal testing is another tool in my toolbox. We also are able to do nutrition testing. Really, it comes down to lifestyle choices, and living in America is a major burden. We are exposed to over 10,000 chemicals in our food supply that the FDA allows to be in the foods. I recently traveled to Europe, and in Europe, they only allow about 350 chemicals into the food supply. So we found it interesting. In Europe, you cannot purchase Diet Coke. You can purchase Coke Zero. You can purchase Coca-Cola, but not Diet Coke because of the aspartame in the Diet Coke. It is illegal in Italy to sell that product. So we let a lot of chemicals into our bodies, and those chemicals have a lot of adverse effects. We take a lot of those for granted. So it's hard to be healthy in the United States unless you really learn what you can do in terms of where you buy your food, how you prep your food, the food choices you make can really impact your health. We help guide you down that path, and that's what we're about at Pathways to Wellness. Is getting you on that path to improved health and wellness, always looking for natural solutions, always looking for the root causes. We can also do nutrient testing. I'm a real advocate that most people do need vitamins and minerals to be healthy, especially as we get older. Most chronic disease are driven by nutrient deficiencies, things like vitamin D, B12, the B vitamins, vitamin C. So we can make recommendations in general. I'll talk about those in just a minute. Or we can test. We can do a micronutrient test, a very simple test, blood test, that will look at 33 key nutrients inside of your cells and tell us exactly what's going on. Are you getting enough? Are you not getting enough? Are you getting too much? How much do you need? We can make recommendations more precise with a micronutrient test. Another test in my toolbox. We also test for a problem called methylation. Methylation is becoming more and more of a buzzword in the community, medical community now. Methylation is the process that we use to make energy and detoxify. And methylation occurs in our bodies millions of times daily, but it's governed by our genes. And we can test those genes. We can do genetic testing. There's just really 5 genes that are involved with methylation, things like MTHFR, MTR, MTRR, ACHY, COMT. We can get those measured, and we can determine if you have a significant or maybe just a minor variant of any of those genes, and then what you can do about it. Although we can't reprogram your genes, we can give you measures to help get you through that barrier. Oftentimes it's lifestyle, diet and supplements, but specific supplements, specific dietary measures for specific genetic issues. So we can do a methylation panel and really sort out for you where your barriers are. This is a simple blood test and cheek swab test. You only do it once in your life because your genetics never change. It probably will not be covered by your insurance. You're probably going to have to pay for this. The panel we run is $380, and I've seen these marketed by many, many people. You can certainly get it someplace else, but they're all in the $400 to $600 range typically. So a methylation panel may be something that is a tool in my toolbox that I talk with a lot of patients about, and we'll talk more about methylation in an upcoming podcast of Pathways to Wellness. Methylation is a big deal that we're just learning more and more about. So that gives you some idea of the diagnostic testing that we have. We have other testing. We can test for leaky gut. We can test for food allergies, chemical allergies, with more sophisticated testing. We have just a myriad of options, more than I can get through in this introductory podcast about functional medicine. But you can find information on our website at wycoffwellness.com, or you can stop in our office in East Lansing and talk with one of my health professionals about the services we provide, the personalized care, the evidence-based care, and that we're going to center your program around lifestyle modification, diet, exercise, stress management, appropriate nutritional supplements, medications if needed, and we're going to try to integrate those with conventional therapy and maybe therapies that we do or don't do, like acupuncture, massage therapy, things like ultraviolet blood irradiation, ozone therapy, chelation therapy, IV nutrient therapy. We do all of this, all these types of therapy at Wycoff Wellness to try to get you on that path to health and wellness naturally. So seeing a functional medicine doctor can help you maybe put things together, can integrate things, and allow you to get on that road to health and wellness and do it in a way that doesn't involve taking more medications. There's a place for medications, but medications have side effects, and instead of approaching problems with a pill for every ill, let's see if we can find that root cause and move on. I'm going to end the broadcast just talking briefly about some of those basic nutritional supplements that I recommend for almost every patient. We can do testing. Testing can involve some money, but supplements, although it has some cost, the most expensive supplement you'll ever buy is one that does you no good. So you need to find a company that makes quality supplements. We partner with a company called Metagenics and some other quality companies, but there aren't a lot of them. So Metagenics makes, I think, the highest quality supplements that are available. We recommend a good methylated multivitamin mineral supplement. The one we recommend is called Phyto Multi. Phyto Multi comes in a tablet and capsule form. For a typical adult, it's 2 tablets for 3 capsules a day. You should take them every day. A high-quality pure omega-3 fish oil. We recommend Omegagenics EPA DHA 720, 3 to 4 a day. Again, this is a pure fish oil. All the impurities are taken out. It's quality checked. Great product for you. And we recommend vitamin D3. Again, you want to check with your doctor about specific supplements that you take, but vitamin D3 for an average adult at 5,000 IUs per day, that should be guided by blood testing. Your doctor can get a vitamin D level for you. We want that level to be above 50, up to 100 or so nanograms per ml is a good goal. So we can get those supplements separately, Phyto Multi, Omegagenics, vitamin D3, 5,000, or you can get a Wellness Essentials packet. Metagenics puts them all into one with the exception of the vitamin D, and that can be a better price option for you. You can get our supplements all at our office in East Lansing, 1226 Michigan Avenue, or you can go online at our online store at wycoffwellness.com, WYCOFF Wellness, WELLNESS.com. Link to our online store, and we offer free delivery with any order over $50. You can stop by our office in East Lansing, or you can always just give us a call if you're not sure what to take at 517-333-7270. That's 517-333-7270. Well, that wraps up this episode on functional medicine, integrative medicine, family medicine, to give you a better idea of what we do at Wycoff Wellness. This is Dr. John Wycoff wishing you health and wellness. Get in charge of your life and get on that path to improving your wellness today.